Welcome, and thank you for tuning into A Sound Constitution on CHLY 101.7 FM with Ryan, Matt, Aminder, Alicia, Matthew, and Emily. We are fourth-year BSN students at Vancouver Island University in Nanaimo, British Columbia. We are working to demystify health issues affecting our community, bringing you evidence-based information about healthcare. This information is for education purposes only and does not replace the advice of your primary healthcare provider. We would like to start our show by acknowledging that we are on the unceded territory of the Sunemu people with a broadcasting range that overlaps the Kawatsan and Siaman territories. This acknowledgement is done with gratitude to the Sunemu people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Sunemu history, reconciliation, protocol, and land acknowledgement can be found on our Facebook and YouTube pages. Today's episode will cover challenges older adults face in the COVID-19 pandemic. It will be presented by Aminder, Matthew, and Alicia, who are fourth-year Bachelors of Science nursing students at Vancouver Island University. Today's show will start with a discussion section by presenting relevant facts and information regarding the daily experience of older adults and the challenges they face and the solutions to help mitigate those challenges. Later on, we will have an interview with Kim Love, who is a registered nurse and clinical nurse lead at West Haven Long-Term Care Facility in Port Alberni. We hope you enjoy the show today. Thank you. In this discussion section, Alicia, Amin, and Matt will talk about the challenges older adults and their families face in life and COVID. We will provide resources and tips for safety. Thank you. First, we'll have Aminder discuss the social isolation that many older adults are facing at this time. Thank you.
Let's discuss the challenges of living in long-term care facility and how COVID has affected the lives of older adults in long-term care facility. According to the article, Loneliness and Isolation in Long-Term Care and COVID-19 Pandemic in the Journal of Post-Acute and Long-Term Medicine, the authors Joyce Simmert, MSW, Ladislav Walzer, MD, PhD, discuss that social isolation and loneliness pose a serious risk to seniors, even though the issues are mostly overlooked in the society. They further state that the prevalence of severe loneliness among older people living in care homes is at least double that of community-dwelling populations, 22 to 42% for the residence population compared with 10% for the community population. Now, let's discuss what's the meaning of social isolation and what's the meaning of loneliness. CDC defines loneliness as feeling of being alone, regardless of the amount of social contact, whereas social isolation is a lack of social connections and can lead to loneliness in some people, while others can feel lonely without being socially isolated. The article talks about the feeling of loneliness has many consequences that include increased risk of depression, anxiety, impulsivity, as well as increased risk for cognitive decline and progression of Alzheimer's disease, elevated blood pressure, and mortality. In the same article, there is this interesting thing I found, which is that loneliness has 3 dimensions. And the first dimension is personal loneliness, which is often related to the absence of a significant person like a spouse or a partner who provides emotional support and is someone who affirms one's value as a person. The significant someone could be a pet as well. This is commonly seen at long-term care facilities as seniors are unable to see their significant others on daily basis due to COVID restrictions. The second dimension of loneliness is the absence of a sympathy group, which can include 15 to 50 people who are seen regularly. For example, bingo groups. The third dimension is a lack of an active network group consisting of 150 to 1500 people who provide support just by being together in a group. For example, church services. In the end, this article states that preventing the loneliness and social isolation is as important as helping the seniors with their personal hygiene at long-term care facilities, especially at times of COVID-19, when outside contact needs to be minimum in order to prevent any infections. Many long-term care facilities provide residents with window visits and daily Zoom calls with their loved ones as some of the many ways to help them cope with loneliness, and these efforts by the staff members can significantly improve the quality care of the seniors living in the long-term care facility.
Did you know that bananas will help turn a frown upside down? Boost your mood with good nutrition. Get relevant health info at A Sound Constitution, airing on Thursdays at 2 p.m. at CHLY 101.7 FM. Hello again, it's Matthew. I'm going to discuss the challenges that older adults face in their daily living and how that's been become more difficult during the COVID-19 pandemic. I will also provide some tips for safety and family support during this difficult time. Thank you. Older adults face a variety of challenges to fulfilling their daily activities, from difficulties cooking, cleaning, and maintaining their household, to connecting with friends and family, as well as transporting themselves to appointments. The quality of health of people declines as they age, putting older adults at a greater risk of infection, disease, and health challenges associated with that. Furthermore, common psychological issues affecting older adults and patients may include, but are not limited to, anxiety, depression, delirium, dementia, personality disorders, and substance abuse. These psychological issues can be exacerbated by common social and emotional issues that may involve loss of autonomy due to muscle and joint issues. They can also be worsened by grief from losing loved ones, fear of disease or the aging process, loneliness from the loss of friends and family, financial constraints from lack of income or poor retirement savings, and lack of social networks. COVID-19 has put additional hurdles in front of older adults' well-being. This is according to the CDC and the NIH. Older adults have been affected by COVID-19 in a variety of unfortunate ways. First is they are at a much greater risk for having complications from being infected. As you age, your immune system strength declines, and your ability to fight infections decreases. Furthermore, older adults are more likely to have pre-existing conditions like COPD, heart disease, which diminishes their capacity to fight infection. This risk of infection could also limit the ability of older adults to run errands and take public transportation. There are resources that we'll talk about later to assist older adults in these challenges, and Alicia will be giving you these resources in the community. For older adults venturing into public spaces, it is important to take time to practice protective measures. Keep these items on hand and use them when venturing out. A cloth mask, tissues, a hand sanitizer with at least 60% alcohol. If possible, avoid others who are not wearing masks or ask others around you to wear masks. When it comes to small gatherings, older adults should be sure they have good communication with the people they are visiting. Communicate and stay home. If you or your family or friend has COVID-19 symptoms or has had contact with someone with COVID-19. When at a small gathering, social distance by 6 feet and remain in a well-ventilated room. Wear a mask and wash your hands often. Also, if you have been infected or anyone else you know has been infected, they should self-isolate for 14 days until their symptoms go away. So taking these proactive measures is the best way to protect yourself and others. Finally, it is important to stay healthy during these difficult times. Older adults should be sure to get the seasonal flu vaccine. Make sure you take all your medications as prescribed if you're having underlying medical conditions such as asthma, diabetes, or heart disease. If you have any concerns, contact your health provider. If you have trouble with transportation, to go to the doctor or the pharmacy, contact a local senior service assistant. We'll also talk more about these resources at the end of the discussion with Alicia. The families of older adults have been affected in a variety of ways. For families where their loved ones are in long-term care, it can be hard to see them regularly or at all. Most long-term care facilities have a rule in place where only one family member is designated and signed up to visit. However, there are many ways that families can connect with their loved ones in long-term care. The first is through virtual communication. These can be platforms like Zoom, Skype, FaceTime, and others. Connect with your relative's long-term care home and see what platforms they are using. You'll be most likely need to call and book an appointment to meet with your family member, as there is usually a computer or tablet that is shared amongst the residents. There are many ways to connect with your family members in long-term care. When you connect with them, you can ask them if there is anything special they would like to have. Ask them if there's any food or personal item that they would like to have. Most long-term care homes only provide generic products. If they want anything specific, like a specific type of shampoo or a specific type of food, you would have to provide that. And they would really much appreciate it if you would provide that. Some residents might feel like they have difficulty communicating their wishes to people they don't know very well, so the staff in the nursing home. So it's important to communicate with your family members and ask them if they would like to join any recreational or community activities. Connect with management at long-term care facilities to see what activities are available. Keep long-term care residents and families feeling connected and included will go a long way in helping everyone cope and get through this isolating time. Next, Alicia is going to go through the resources that are available to help seniors in our communities. Thank you.
We thought it would be important to include some resources available in our community to support families of older adults during this pandemic. The BC Seniors Guide is a book-style compilation of information and resources to help us all plan for and live a healthy lifestyle as we age. It includes information on provincial and federal programs with sections on benefits, health, lifestyle, housing, transportation, finances, safety and security, and other services. You can download the PDF version of the guide, read it online, or order a hard copy from our BC governmental website. Seniors First BC is a resource hub online that includes municipal, provincial, and federal programs aimed at helping seniors with housing, transportation, and dental concerns. The Nanaimo Travelers Lodge has some programs geared towards seniors' health and socialization efforts. They can be reached at 250-760-2636. Granny Go-Go is a one-on-one companion service also geared towards seniors. Clients are transported from their residence to places such as doctor's appointments, grocery shopping, and other small errands. Employees will sit in appointments with you if asked and will also help get you situated at home, including putting away groceries and minor housekeeping tasks. You can register for Granny Go-Go services at 250-714-9715. Nanaimo Harbor City Seniors offers a complete range of cultural and recreational activities to anyone over the age of 60 or anyone who has a partner over the age of 60. They also offer hearing and blood pressure clinics. There is a yearly membership fee to access their services, but they can be reached at 250-755-7501. The Seniors Connect Center is another place for adults aged 55 or older that promotes independence, personal enrichment, and an enhanced quality of life through social engagement. Programs and activities focusing on social inclusion and health and wellness are provided free of charge. The center is wheelchair accessible and has a wheelchair accessible bathroom. The Seniors Connect Center also offers outreach services, access to information, and referrals to connect seniors with other programs and services in the community that may be of particular interest to those experiencing social isolation. Seniors can register by phone at 250-591-2924.
That was a discussion about the challenges that seniors are facing in our communities in life and in COVID. Coming up next, we'll be having a wonderful interview with Kim Love. She is the clinical nurse lead at West Haven Long-Term Care in Port Alberni. Hope you enjoy that. Thank you. All it takes is a 30-minute walk a day to boost mood, energy, and happiness. Learn more about health and wellness by tuning into A Sound Constitution, airing on Thursdays at 2 p.m. at CHLY 101.7 FM. In these stressful times, we are waiting for change to come in so many ways. And I want you all to know that change is going to come. In that spirit, we have a great song up for you next. It's called A Change Is Gonna Come by Sam Cooke. Here we go. That was Sam Cooke. A Change Is Gonna Come. Do you have a family member in long-term care? Learn how to keep in touch by tuning into A Sound Constitution, airing on Thursdays at 2 p.m. at CHLY 101.7 FM. All right, if you're just tuning in, we're now going to be having an interview with Kim Love. She is the clinical nurse lead, a registered nurse at West Haven Long-Term Care in Port Alberni. Hope you enjoy it. Thank you.
So my name's Kim Love, and I'm the clinical nurse lead at West Haven. West Haven's a 30-bed long-term care facility. We have 2 respite beds that are closed, 30 beds that have permanent residents, and I have no on-site manager, so I run this most of the time, but I'm also the frontline nurse on the unit 3 days a week, handing out pills, doing dressings, and all that kind of stuff. So we have no social worker at the moment, and we have no on-site PT, so I help with all those different things. So it's pretty vast access.
Right. Okay, so when it comes to seniors with COVID, for seniors living in long-term care, can you speak to what the COVID-19 safety plans are currently looking like?
Okay, so the safety plans are, we have 1 unit working, so that means no staff can work, now frontline staff, which means RNs, LPNs, and RCAs or healthcare or care aides are allowed to work at more than 1 long-term care facility. They can work in the hospital or they can work in the community, but they cannot go from one place. So you can't go from Echo Village to here, and that's a provincial order. The other one is restricting visitors. They have 1 social visitor per week, up to 90 minutes, and they can't change that. And if there's an outbreak, all visitors stop. The visiting professions, the physiotherapists, those kind of things, they can come in. They follow strict access into the building. and things like the hairdresser is now allowed to come back also, but everybody has to have their own individual safety plans. The other safety plan is you come in, our front door is locked, you are screened, you do a temperature check, and every 4 hours staff have to do temperature checks. We do temperature checks to every resident daily, and if anybody has COVID-like symptoms, they're on isolation immediately. So we keep that all pretty straight, and the one unit staffing makes it pretty tough because we're small and most of our casuals work at more than one place, and they had to choose where to work. So that's made that really difficult.
Right. And so it's like a lot of staffing issues involved with care aides and nurses.
Lots of staffing issues. I have no casual RNs. My 2 casual RNs work at the hospital and community, and they work full time. So that means my part-time RN picks up a lot, and a vacant line is hard to fill because just one of the first things that just got changed November 8th was we're now allowed to post jobs permanently. Before that, in long-term care, we were only allowed to do it temporarily, and nobody wants to take a job temporarily. So we're down RNs. LPNs are pretty tough. The RCAs, we hire lots. So they've been tight, but not as tight as the professional staff.
What about in regards to doctors coming to see residents?
So the doctors, they have to go through the front door screening like everybody else, and they can come in and see people. The doctors themselves try to come in prior to going into acute care, and everybody has to wear a mask on the unit. So as soon as you walk through our doors, you wear a mask. The government says the provincial order is if you're going to be within 2 meters of a resident, you have to wear a mask. We wear a mask constantly because we don't know when they're going to come up to us, the residents, because they walk around, they do their own things, and that. So the docs have to follow those guidelines also, and they're pretty good. Sometimes we have to chase them with a thermometer to take their temperature, but they're pretty good at that. And the new admissions are in isolation for 2 weeks. And if they don't stay in the room, then we have no way of shutting them into their rooms. We don't do that. We don't restrain them. So we get a 1-to-1 staff member with them, and they have to wear a mask and get their hands washed constantly if they walk outside the room, but we try to keep them in the room for 2 weeks.
Okay. And in regards to family visitors,
Yeah.
what are the rules along those lines?
So the family visitors, our safety plan for them is they come in, they do the COVID screening, they sign the contact tracing sheets. We escort them to the room, and then when their time is up, we go back and get them, and we escort them back off the unit to avoid them stopping to visit other people along the way. And while they're in the rooms, for social visiting, they must wear their masks the whole time. They can be affectionate, they can give a hug, they can give a kiss, but it has to be through the masks.
What are some of the feelings and concerns that residents have been verbalizing throughout this pandemic period?
So most residents don't realize the difference, and that because they're cognitively not able to. The ones who are feeling, one feels it's like a prison. Oh, it's probably more than one. A couple do. And because they're not allowed to go out. They're used to going out ad lib, and they haven't been allowed out since March 16th. Others, we compensated by, I do their personal shopping for them, so I make sure the one gentleman gets his cigarettes. The one lady who goes out and visits people lots, I bring her in pop, every week, so that she has something special to look forward to. So, but yeah, they're feeling caged.
Yeah. What, if any, physical, psychological, and social impacts have been recognized to be occurring for residents in care?
I think at first, when we weren't able to have access to physiotherapy or rehab assistance, we had a lot of decline in mobility. And now that the physiotherapist and rehab is back, that is definitely changed. They're up and they're doing much better in that aspect. Socially, for the majority of residents, I don't think it has declined. We've done virtual visits with people, and so for some residents, they actually see their family a bit more because of the virtual visits. and because of the scheduled visits and that. So, but for the couple that are used to going out and isolating and socializing, they're definitely probably a little bit more on the downside emotionally.
What interventions have been implemented that continue to keep COVID-19 safety plans in place, but also support the psychological and social well-being of residents?
So we have done the virtual visits. We have done what we call essential visits. So there's a difference between a social visit and an essential visit. An essential visit is discretionary. We can talk about it on the unit amongst our stuff, and then I can present a case to the manager, and they say yes, they can come in for an essential visit. So an essential visit, if for somebody whose mood's really low, I can bring them in. If there's a sudden change in their physical abilities, and say these clients suddenly got really sick, I could bring somebody in, a family member in, and they've changed, and the life protocols now. So the life protocols allows us to have two visitors at the bedside, and those visitors can change up as often as the family wants them to change up. You could be sitting out here waiting and just go back and forth between however many people, and that. So that has definitely helped. We have done more. We try to do. Everybody loves bingo, so we've been doing more bingo, and we implemented a little bit more one-on-one with residents. In the summertime, we would take them outside for walks and those kind of things. One resident whose mood has been really low, we started reading Harry Potter to him. So we've tried to step it up in that aspect.
Right. So what does family visitation look like right now, and overall, how have residents been responding to this in general?
Residents have loved it. Family have loved it. The disadvantage is, how do you decide which family member gets to do it? Because sometimes there's only one family member, or maybe it's a close friend, and then the others have not been able to come in, and that's been really tough. So I think it's been more tough on the family than it has been on the residents, and that because we're part of the residents' family too, and some families would see their family members all the time, and there's 5 kids. Well, now suddenly only one person can come in,
right?
And so I think it's caused for family a lot of stress in between siblings, in between different family members, about who's been allowed to come in and who's not.
Right.
But the interactions during the visits have been very positive, and lots of smiles and talking, and people are bringing in photo books and looking through pictures and having different interactions than they didn't have before, because it's a scheduled type thing, and I think this has just made everybody realize how valuable life is.
What are some of the challenges that have been identified to support restricted visitation?
What do you mean by that?
In terms of maintaining the restrictions between the families and the...
So we have locked our front door, so nobody can access the building without us letting them in. We have set up a schedule, so you make an appointment to come in, and the people, if they have questions or concerns, they address it with me, and if they have if they really want to take it, they can take it higher. There's a phone number through Amin Health that they can call and lodge complaints and concerns, and that most of the time family's quite happy with verbalizing to me, positively and negatively at times, but it's been pretty good. We did a 4-stage social visiting plan. The first stage was to implement 3 visits a day, Monday to Friday, ending before I left, and so I could help orchestrate it. And then the next stage went to 6, up to 6 a day, but kept it Monday to Friday. We tried outside those times, and family, it was like herding cats. They were all over the place, herding chickens, and weren't following the rules, weren't wearing their masks, and weren't listening to staff. So we backed it off and went back to only having visitors here while I'm here. Because then that way, if there's any problems, I'm an authority, and they usually will adhere to things if I'm here. If it's regular staff, they don't. So we're going to stage 3 next week, where we're opening up again onto Saturday and Sunday visitations. So we're hoping it all goes well after having several months of the Monday to Friday visits.
What restrictions changes are you anticipating going into the winter?
I'm hoping we get to maintain what we've got. I don't think that they're going to open it up to more than one person visiting. And we're fortunate that we can get all our visits in a week. Bigger facilities aren't as lucky. So some families are only seeing their loved ones every 2 weeks, every 3 weeks. And that. So I think if with the ramping up of numbers, if we can maintain what we got, that is great. We are planning, Christmas has kept me up at nights, because that's the time where a family wants to get together. And for some of these people, it could be their last Christmas. And to keep family away is horrific in my behalf. So we have decided to go with a door visit. We have not done door visits or window visits very often because they don't work out well. People get too excited and it's just chaos and stress. But we're going to put a safety plan together. It has to be approved. But we're hoping to use the far door over here. It opens up. There's a little bit of grassy area and it's totally fenced in. And we'll get a overhead gazebo, portable gazebo, decorate it for Christmas.
Oh, nice.
And give everybody a window or a door visit. And there'll be somebody, a staff member there that can pass gifts or treats back and forth. So they'll have 30 minutes of whatever family members you want out there. And it won't be on Christmas Day because I just can't see how you can choose who gets to have those slots, and you can't have everybody. So we'll do it the week before and the week after. And we will send out letters to families with it and so everybody should get their letters about the same time. Then they can call in and book their appointment so that not one person would get the prime time. It'll be sort of a lottery.
Right. And they would call into
They'll call into our front desk and they will have a schedule. We'll have a specific schedule for that week. We'll stop the social visiting for that week because we don't have the staff to do both. But this way everybody will get a chance to see their loved ones. You know, it doesn't matter who it is. The other thing that we don't do right now is nobody under the age of 18 is allowed on the unit.
Okay.
And that, so we do have pets on the unit are allowed to be brought in. They were allowed to come back. So.
Okay, pets are.
Yeah.
And is it just limited to like one pet or? Yeah.
One pet, one person, because you can't really manage more than that. Yeah. And all visitations are done in the rooms.
Right.
And that we have one special allowance because the resident gets so distraught when you remove her from the common area that we've kind of isolated her and her family member in the common area so that they can have a quality visit. Because if not, no visit would be able to be occurred. We tried in the room and it was just a horrible experience for everybody involved and no quality of life for anybody.
Right.
So we got special allowances for that.
Have you seen like the relationships between staff and residents strengthen over the last 9 months? Because we're so small, we have really good relationships with our residents anyways. And that, so some have improved, some are like, okay, we've been closed up here too long with everybody. Right.
And that, but the majority of it has worked out really, really well. And we've compensated for a lot. So they used to go shopping at Walmart every month. So people would go up and buy their personal items, their shampoo, their body washes, those kind of things. And the activity staff would buy the people who did go, would pick up what they needed. They'd have a list. So they can't do that. A lot of them don't have family here. And so the family can't do that. So I am now currently the personal shopper for probably 12 people. And aka why I have a whole bookcase full of personal items. They call it Costco. And so we just compensate. And I just do that when I go do my own personal shopping. I do their shopping too. And
nice.
And then their personal accounts refund me. Like I don't buy it out of my own pocket. I'm refunded. So if the one gentleman who'd go out and get his own smokes every other day, I buy a carton of cigarettes for him so that, because he's not allowed to go do that. So they're not doing without anything. And we're not expecting family to come from Campbell River or Victoria to buy soap.
Right, for sure. What about for online shopping like Amazon or?
We've done a little bit of that for depending on what it needs. So there's certain clothing items, that kind of stuff. But try to shop local.
And has there, like, between different nursing homes, has there been a connection to support each other, like between different facilities?
So we have a within Island Health, we have a group of clinical nurse leads that was meeting weekly to discuss the pros, the cons, and any issues and help problem solving things. And now we've expanded it. I think we meet every second month, and that. But yeah, and we have a lot of different levels to help. I have a COVID coach who's on site, who is also my nurse educator. And so between her and I, we struggle through things and get everything up and running. And she, if I need to ask a question about COVID, I go to her and she researches it and finds the information for me. So yeah, there's lots of in there to support us. This is not a sustainable thing though.
Right. Yeah, for sure. Has technology in terms of like virtual communication, has it been seen as benefiting residents and families?
The technology definitely. Yeah. The virtual visits were huge, especially in the very beginning. And that once we got it up and running, some residents actually had more contact with their family than they've ever had.
Oh, wow.
Because it was easy to do a quick 10-minute, 15-minute virtual visit. And they were from out of town, or they were busy, they worked, or whatever reason that they weren't able to get in here. So,
and what platforms are being used?
So we were donated by one family member a tablet, and another group donated us a iPad. So we're able to use Messenger, FaceTime. Yeah, Messenger and FaceTime I think is what they use most of the time.
Right.
And it's been quite successful.
That's great. What resources in the community is there to help seniors at home fulfill their activities of daily living?
That I'm not 100% sure of. I know that home support got beefed up because the AD or the adult day program has been canceled, and so they can't get their respite been canceled. So they've been doing more and more in-home stuff in home community. But other than that, I'm not thinking there's a lot, but I'm not sure.
Right. And what resources are there in the community to help families support each other, and in terms of like coping with their resident or their family member in long-term care?
I don't know that there's any, and that I really don't know if there what there is, and that unfortunately, I have been seconded here and can't cope with anything else other than here.
Right.
So,
sure.
Family calls me, and we talk and give updates. We send pictures when we can of activities, that kind of stuff. So we try as much to include them, because family is when we have a resident, we also adopt their family, and so we try to incorporate a bit more of that. But yeah, there's been a huge loss of connection.
Right. Yeah, it's unfortunate reality.
Yeah.
In terms of like residents going out for like tests, or in the community need to go for like an MRI or go see.
Okay. So now things have changed. Now they can go out for appointments, but they have to be escorted if they're not causally intact, and they have to go by Medivan because they can't go by taxi or personal drivers. And that, so if you have an eye appointment, you go. If it's something that could be postponed, if it's not essential, then we don't. But for instance, somebody needs a pacemaker check, then they can go to an IMOE organized Medivan. If they have to go to the cancer clinic, they go by Medivan. And that because Medivan has a standard and safety plan, and we screen the drivers and all that kind of stuff. We can't guarantee that they don't stop, because they cannot stop at a restaurant, a coffee shop, shopping at the mall, or somebody's house, or anything like that. And They're not supposed to sit side by side to the driver. They're supposed to have their own areas, and just to decrease their exposures. If you get admitted to hospital, when you come back, you're isolated for 14 days. If you go to the emergency department, to the x-ray department, or anything else, we send you with a mask. Hopefully they keep the mask on, and they don't have to be isolated when they come back.
Okay, that's good. So trying to minimize the time spent isolated, for sure.
Yeah. Isolation is a nightmare for us, and it's horrible for the resident. For some
Right.
residents, it doesn't make any difference, but majority of them, being stuck in a room for 14 days.
Oh, yeah.
So one of the challenges that I have, and some ethical challenges I have, is having somebody come in for 14 days, because they're a new resident, they move in, and there's no TV in the room. We have cable hooked up in the room, but we don't have any TV in the room. They don't have a family member, or they don't have the funds to get a TV in the room. So now you're going to spend 14 days with nothing.
Right.
And I can't do that. So one case, I approached the West Coast Hospital Foundation, and they purchased us a TV. They had it within half an hour of my request. We had a TV up and in the ladies' room. I have 2 respite rooms, and they have TVs in there that were donated for the respite room. And I have been known to very nicely ask the facility management guys to come over and move it into another room until we can get the TV for that person. So far we've been able to kind of borrow from Peter to pay Paul to at least have a TV in the room.
Right.
And that, because what else do you do?
Well, it's great you have those nonprofit organizations and those foundations that can support that.
Yeah. So the foundation here, our hospital foundation is amazing.
Yeah.
And they've got a small petty fund that they were able to, like I say, purchase the one TV, and the other TV that I keep getting, the guys from FMO, they're not happy because it's like, I just moved this TV last week. I'm like, I know. But I really need it in that room now, and I'm not allowed to move it, so.
Right. Have you seen like a difference in between residents who are private pay versus publicly funded?
We are all 100% publicly funded.
Oh, okay.
And we're the only Island Health facility in Port Alberni. The other 3 facilities are affiliates, and so they're also partially publicly funded. They do have private. I think Echo has a private, and Rainbow might too. They have some private pay beds. So, and I don't know if those are even in operation right now. But ours is totally funded, and everybody pays a bit differently because it's a percentage of your income coming in, and I absolutely stay out of funding.
Right.
So I don't care if you pay your bills. I'm going to look after you no matter what.
Right. That's great.
Yeah.
Is there anything else you'd like to add for like families and seniors in the community to know about in this time?
What I see and what's happening, I believe, is that people being admitted to long-term care right now are the ones that are in crisis. The ones that are able to manage their loved ones at home are keeping them at home because then they can still see them and have connections with them. So to keep out, and they need to really utilize their community resources, family resources, to keep everybody safe and sound, and to realize that when it comes to the point where they can't, and it is a crisis, there's nothing wrong with them coming to us, because we will look after them, and we look after them like they're ours.
Yes.
Like they're family members, and quite often they are family members.
Yeah.
And my grandmother was here for 4.5 years before she passed away, and I was her primary nurse. And so we will always look after them. So we are here, but right now for most people, home is best, but it's got to be safe. And if it's not safe, then it's time to let go and let us be the caregivers. And this will end eventually, I hope.
Yes, eventually it'll come to an end. Yeah.
I hope.
I think they say pandemics usually last for 18 to 24 months.
Yeah.
Yeah.
My wishful thinking of 3 to 4 months.
Yeah. Well, thank you so much, Kim,
No
for
problem.
joining us today. That was Kim Love. She's the clinical nurse lead at West Haven Long-Term Care in Port Alberni. Before closing the show, I would like to leave you with a song that provides some perspective and peace of mind during this difficult time. It is called Don't Look Back in Anger by Oasis. Thank you. That was Don't Look Back in Anger by Oasis. You've been listening to Matt, Aminder, and Alicia talk about the challenges older adults face during the COVID-19 pandemic. I'd like to thank you for joining us today. We are on CHLY 101.7 FM Thursdays at 2 p.m. You can follow us on Facebook, Twitter, Instagram, and YouTube as well. Thank you.